Hi everyone. Good morning and welcome back to my channel Learn with Dr. Akshata. For those of you who are new here, I am Akshata, currently Assistant Professor in the Department of Infectious Diseases in KMC Manipal. So I thought of doing this impromptu FAQs. So I have been receiving over the last past few weeks various questions regarding pursuing MD Microbiology, then the scope of DM Infectious Diseases after that. So I thought I will do a short Q&A session now. I will just be going through the questions which I have got asked in various social media platform which I am active on. Yeah, coming back to the questions. First and foremost, the career scope and job opportunity uh, in microbiology and infectious diseases. What are my career prospects for doing MD microbiology? Um, as I have already discussed in a separate video addressing the various career prospects after doing MD microbiology, it can be in the academic setting, it can be research or hospital-based roles. You can be as working as a consultant, or if you're interested in a more academic setting, so you can join various medical colleges as uh, a professor. Then there is also definitely you can join the private labs where you will be working as consultants, and then there is an increased demand for infectious microbiologists after the COVID-19, as we all know. There is there is role in hospital infection control as well as the increasing AMR rates. Also, there is a role in implementing AMSP as well. So the recent like it is necessary that there is an infection control officer in every hospital. Apart from that, you can even go to the public health, where you can join the various institutes of importance, you can join the TB, you can join the NIV, then you can also higher end, you can join the CDC or the WHO. So, how does pursuing DM infectious disease after MD microbiology expand these career opportunities? So, as we all know, during the training of this DM infectious diseases, it gives clinical training to the MD microbiology graduates to work in the clinical settings, and you are seeing the patients directly. So, your work will be a ID physician, and which in India there is increased demand for the ID. So the scope for infectious diseases has recently becoming more common and more popular. So the ID in India is in generally uh, early stages. So it is less than around 10 years which it has got the scope. So after the COVID, after the increasing the government plans for the antimicrobial resistance, it has further increased and it is still going to definitely increase. One thing which is evidence is the increasing number of infectious diseases department which have been set up. So another thing is obviously what I get asked is the salary prospects for MD microbiologist and DM infectious diseases. The salary for the microbiologist varies from the role and the setting. It can be in the academic, it will be a almost in a government institute, it will be uniform through the clinical as well as the paraclinical. But in the private side, the pay will vary between the clinical and the paraclinical or the subject. Um, and Definitely it's competitive, so there are various private labs which can offer good pay. So like just fresh out graduate who is coming out as MD microbiology in a tertiary care, I mean in a tier 1 city may expect around 1 to 1.5 lakhs depending upon the setting. Then, as a DMID, definitely you can expect better pay because it is a super specialization, and there is increased scope in the private hospitals. So, how is the next question is how is the field of microbiology and ID perceived in India? As we all know, microbiology, though it is crucial, it is considered a laboratory-based specialty and will is generally perceived down, and because there is lack of patient interaction, and but this role has gained importance as I mentioned before, because of the COVID-19 and the increasing antimicrobial resistance. And again, it depends on the hospital you're working in. So most of these INIs have made it compulsory to have a hospital rounds or pathogen directed AMSP. So you will have contact with the patients, so you can interact with the patients. And again, I would like to say that it is all dependent on your passion. So I have seen like residents who are in a very well established good institute such as in the INIs, but still they are not interested in going beyond the lab. So next is how does how is the training in the infectious diseases, and how can I make this transition between micro to ID? Is it difficult? Is it easy? So I would never say that it is an easy transition. First and foremost, you have to be prepared, because at DMID the seats are limited. So previously there was only in INISS that was limited to AIMS. Now there is increase to AIMS, and as well as PGI has recently started it. And next main improvement is in form of inclusion of microbiologists as a feeder branch for infectious diseases in NEET SS. So again, that will be the first batch, which will be or like the next session batch, that is usually that the exam in the March 2025 will be the first batch. So the prospectus has not yet come out. So through NEET SS, if the microbiology is given and chance to pursue DM infectious diseases. And currently, as per the last NEET SS, the colleges where the KMC Manipal, then we have in Kerala, then Kolkata, we have School of Tropical Medicine. Um, so two colleges in Kerala and two colleges in Kolkata, where they mentioned in the previous, as per the previous NEET SS matrix. The newer matrix is expected and is supposed to include the microbiology as a subspecialty, which is eligible for pursuing DM infectious diseases. This was as per the latest NMC update. So again, I would say it is not an easy exam. INISS last 3-4 years, very few people have been able to qualify it. So definitely it requires preparation, and I would not say that it is entirely dependent on the preparation, because the question paper format of INISS was such that it was not favorable for the microbiologist or the other like medicine branches, because it was almost like 30 to 40% of basic sciences, which is medicine, then 30% of again medicine, and 30% only was microbiology, so which was pure microbiology and pure medicine. So in a way that both the branches were not able to make qualify the for the same. I mean, through NEET SS, the exam pattern as per the last update is so there is medical branch as well as the surgical branches. So through the medical branch, for all the specialties, it's a common exam. So definitely you'll have to be more prepared in the medical or the medicine aspect rather than the core microbiology aspects, which requires sufficient preparation. So next, what are the good institutes for DM infectious diseases in India? Again, through INI as well as NEET SS, it varies. So obviously, through the INI SS, AIMS Delhi has started prior, so it has good experience and a lot of students who have pursuing 6 years courses as well. So they have good experience. AIMS Jodhpur is also good. Next, in PGI Chandigarh has recently started the DMID program. There is no student as of now. Next is AIMS Raipur. The thing is, PGI as well as AIMS Raipur, they have started as clinical ID, which does not give eligibility for micro for to pursue the DM infectious diseases there. Then through the NEET SS, KMC Manipal is a very good institute where you have good exposure to various tropical diseases, and it's established department since past 4 to 5 years. And then we have the School of Tropical Medicine in Kolkata. Definitely, Kolkata is a big hub of tropical infection, so it's an excellent opportunity there. Then Kerala is doing a great job, so we have great mentors in Kerala. So if I'm not mistaken, I think it's Tiruvananthapuram and one more institute that you can just confirm. It is Government Medical College in Kottayam. Sorry, Kottayam. So yeah, so more and more institutes are supposed to be included. So the recent matrix is not yet out. So more institutes are supposed to be included, and more departments or the individual departments are supposed to have been started. So next question which I commonly get is the transition between a microbiologist and the as an ID physician. This transition is not going to be very easy. So basically, because it's not like you're not trained in clinical skills, you are trained, and as per the government of India, as a MBBS, you are registered or licensed to practice. So basically, it is like retraining. So you'll have to relearn various things. The first initial 1 year is going to be tough. So if the again, I would like to say that it's all based on your passion. If you are passionate about something, nothing is going to be difficult. So you will make time and you will give that time, and you will try your level best. So you will relearn a lot of things, and once you're bedside with the patient, then you will understand various nuances of the treatment, etc. Then when can we make up for the clinical skills? Yes, definitely. It's like you are relearning, and if you are interested to pursue DM infectious diseases from the beginning, you can as well hone your clinical skills even during microbiology. And give any time you go, you can do the pathogen directed AMSP. You can always uh, uh, do the complete patient examination, interact with the patient, take proper history. And next thing is you can take up any of the courses which is offered by various platforms for the medicine part. Then some of them have been fascinated in ID, but they have been demotivated, saying that there are no much vacancy in ID after DM. So again, as I mentioned, the ID field is a upcoming branch, and it is going to be further. There will be further increasing demand for infectious diseases in India. India is a hub of ID, so definitely there will not be lack of any opportunities. Uh, and one thing I would like to say is most of these places will not have a separate department for infectious diseases. So KMC Manipal is one such place where we have separate department. So most of these places there is the ID is under the medicine. So that is why they will. It's not like a preference because it's under medicine. If they have to apply for the job there, they have to have a MD medicine degree. So wherever it is not there under the ID department, I mean medicine department, any even a microbiologist can join the department like me. So, like me, there are various people who are excelling in infectious as an ID physician. So, in the private hospital, there is no demand as such. So, there are many private hospitals where the post micro DM ID residents or the consultants are flourishing. Dr. Monalisa Sahu is one of the examples where she is excelling such that she is one of the been given by the Times of India the best ID physician in the south in the Hyderabad region. So again, as I would say, it's all about your passion. And so another thing which I have heard about is some of them are discouraging to take micro, even though people are interested and they want to take up ID after that, and saying that many people are specifically asking for MD medicine and ID consultants. This, as I mentioned before, it is about the place you're applying for. Because it's under medicine department, it can happen such, but again, there are various colleges which are increasing the ID departments such as such. So there again, there will be definitely the demand. Um, so I think I have addressed most of the question. Then I think other question is what is there is also other roles which you can always apply for. You can be as a microbiologist, be contribute to the public health, in fact, like in infection control, managing the outbreaks, and antimicrobial stewardship, hospital infection control. So these are the various roles you can definitely. It has scope, and the scope is obviously increasing. Um, so, and again, for those who want to pursue further in, you want to move to the other countries, there is definitely two pathways. So, in the Europe, you have the FRC path or the MRCP. So, through that, you can, after writing the exam, if you can shift to these countries. And next is you can definitely shift to Dubai, Abu Dhabi, UAE. So there is increased demand for microbiologists as well there with good pay. And last thing is whether this specialty will keep me engaged and satisfied over the long time. Again and again, I would say, reiterate that it is all based on your passion. If you're passionate about something, you like something, you will definitely excel in any subject you choose. It doesn't have to be any any clinical. It can be any clinical subject, or it can be a non-clinical subject. So again, I would say that many of them will still consider micro as a non-clinical subjects, but it is all based on the place you're pursuing it. I would say, because most of the INIs and most of the premier tertiary care centers are doing excellent job, and they are not just restricted to the labs. And one more career pathway is through the research. So if you are interested in pursuing research, again, microbiology is a great through which you can excel. There is a lot of opportunity as a PhD, even not only in India. In India, it may be less favorable, but if you're planning to shift abroad, it has great value. And so I think I've covered most of the questions and queries. So if you have any queries, just leave a comment below. I will try to address it. I thought I will make this short video just for people who are interested in micro and considering micro as an option, and having doubts. And most of the thing which, like one thing I would say for sure, micro is never a first choice for anyone. It is as blank as that. So that is why whatever you get, you can try to make the best out of it. So when I joined micro again, it was never my first choice, but it was my luck that I got in a great institute like JIPMER, where I was exposed to like pathogen directed AMSP rounds we used to do. So through that, it gave me it built my interest in infectious diseases. And that at that point, when there were just two seats in ID, that is when where I started. Now this number of seats have increased, number of institutes have increased, so you have great higher chances of getting into DM ID if you are interested in that. So it is an excellent opportunity for those who were interested to pursue clinical medicine, but they were not able to. But again, I would say that it is not necessary that every microbiologist will become an ID physician. It is a very competitive exam, and it requires, especially because the pattern has changed now, and it requires more of medicine and medical knowledge. So it requires dedicated preparation, and you can start early to ensure that you're increasing the success, and you may have to give multiple attempts. This applies not only for the microbiologist, it applies even for the medicine, because the exams are going to be more competitive. Uh, and if you ask me, taking micro in JIPMER was the best decision of my life. And further course, like ID happened, and I've never been sad a moment. So each day is a learning experience. Each day you see different cases, and every time you see the patient and they are responding to your treatment, the joy it gives is immeasurable. So again, one more reason as for you to pursue DMID or infectious diseases after micro is yeah, though is that as a ID is not that rewarding for an MD medicine who can also be a cardiologist, who can also be a critical care. So they would most of these are diverted toward other subjects, but the interest in eye infectious diseases is much lesser. So as a microbiologist, it's an you have higher chances because you have lesser competition. So definitely try for ID, but ID should never be your goal. You can There are various other pathways, and there are various people who have chose micro and chosen other pathways like research. Maybe it is research, some are excelling in academics, some are excelling even as a private practitioner, like there is in Jupiter Hospitals, Pune, then Hinduja Hospital, they are thriving. So, and they have been recognized not only at the national levels, they have been recognized at international levels as well. Like I'm sure you would have heard of Dr. Arunalake Chakrabarti, who is a medical mycologist and who is known as the godfather or the father of mycology in India. So, and there is Camilla Rodriguez, ma'am, who is a who has been recognized well. She's from Hinduja, and she's been recognized in the international forum as well for her as a microbiologist for her research and things in TB. So I would say micro is never a boring subject. It never consider it as a subclinical subject or a paraclinical subject. So it again boils down to your interest. If you're interested in that, please do go ahead. And I would also tell that if I have got messages from people who have got just 60K rank, 70K rank, saying that I'm getting this micro. Should I just take micro, or should I give one more chance for going this one? But I would say that again, just keeping it as an option is never an option. So I would say there should be some amount of interest and dedication and passion for you to choose that branch. If you're just taking for the sake of taking, I would say nothing will be yielding. With that, I think I'll end my video here. So for those who have been following my channel, thank you for all your support. And for those who have not subscribed to my channel, who are new here, please do consider subscribing. So for further content, next I would like to start, like mostly I will have few series on this such FAQs or Q&A session. Thank you again. Bye.